John, a 61-year-old male, developed a rare condition causing him to appear intoxicated without consuming much alcohol, beginning around 2004 after a hip surgery and antibiotic treatment. A high blood alcohol level of up to 420 milligrams per deciliter was one of the symptoms, which frequently resulted from little alcohol consumption during meals or right after exercise. Despite his non-drinking claims, he was initially suspected of being a secret drinker. In 2010, extensive medical evaluations, including gastroenterology tests, breath tests, glucose tolerance, endoscopy, and colonoscopy, were conducted. These tests revealed the presence of Helicobacter pylori and Saccharomyces cerevisiae yeast in his stomach, indicating a possible Auto-Brewery Syndrome, where the gut ferments sugars into alcohol. A controlled hospital study confirmed this, as his blood alcohol level increased to 120 milligrams per deciliter, even without alcohol intake. John underwent a 6-week treatment of antifungal medications, fluconazole and nystatin, and probiotics, along with a strict diet free from sugars and carbohydrates. This regimen successfully reduced his symptoms, and subsequent tests showed normal blood alcohol levels and negative stool cultures. He was also treated for H. pylori. John remained symptom-free after these interventions. Ever heard of a condition where your body produces its own alcohol? No, it's not a party trick, but a rare medical condition called Auto-Brewery Syndrome, or ABS. Imagine your gut transforming into a tiny brewery, fermenting carbohydrates into alcohol. This isn't the work of some magical, mischievous gut gnome, but rather the result of an overgrowth of yeast or bacteria in the digestive system. Candida, a type of yeast, is often the main culprit, but other yeast or bacteria may also play a role. This condition can strike anyone, irrespective of age, even children. However, it's a rare occurrence and often flies under the radar. So your body's own brewery is not about serving up pints for a good time, but rather causing an intoxicating turmoil within. Sounds intriguing, doesn't it? But what causes this unusual syndrome? The exact cause of ABS isn't fully understood, but several factors can contribute to its development. Broad-spectrum antibiotics, for instance, can upset the balance of our gut flora, leading to unchecked yeast growth. Chronic health conditions, too, play a role. Those suffering from diabetes, obesity, or Crohn's disease may be more prone to yeast overgrowth, acting as triggers for Auto-Brewery Syndrome. And let's not forget the fuel for the fire, our diet. Foods high in carbohydrates and sugars provide the yeast with the sustenance they need to ferment. It's like throwing a party for the yeast, and trust me, they party hard. Lastly, we have immunosuppression. Individuals with weakened immune systems are more susceptible to infections, yeast included. In these cases, the body struggles to keep the yeast population in check, potentially leading to ABS. So, we've talked about the causes, but what does ABS look like? How does one know they have it? The symptoms of ABS can be quite diverse and often lead to misdiagnosis. Picture this: you've not had a drop of alcohol, but you feel like you've downed a few glasses of your favorite wine. This inebriation, a common symptom, can be accompanied by a hangover-like effect, but it doesn't stop there. You might also experience gastrointestinal distress, such as bloating, gas, or abdominal pain. Mood changes, ranging from irritability to depression or even mood swings, might also be part of your day. Neurological issues like dizziness, memory problems, or a foggy mental state can also occur. Now, how do we pin down this elusive syndrome? Diagnosis involves a detailed discussion about dietary habits, alcohol consumption, and symptom patterns. The diagnosis of Auto-Brewery Syndrome, ABS, is complex and requires careful evaluation. Here's a structured approach to the diagnosis: clinical history and physical examination, detailed patient history, to explore any signs of intoxication without the ingestion of alcoholic beverages, physical examination to identify any symptoms that might suggest intoxication, laboratory investigations, baseline tests, general health indicators to rule out other conditions, metabolic profile, to assess liver function and check for metabolic disturbances, blood alcohol levels, direct measurement of alcohol levels in the blood to detect unexplained alcohol presence. Fecal testing for yeast growth, to identify yeast or other fermentative organisms in the gastrointestinal tract. Exclusion of other diagnoses. It's crucial to rule out neurological and psychiatric disorders that can mimic the symptoms of ABS. Confirmatory tests for ABS. A carbohydrate challenge test may be done, where blood alcohol levels are monitored after consuming a carbohydrate-rich meal or drink. the cornerstone of ABS diagnosis, which involves monitoring blood alcohol level after administering glucose. Standardized test. A fixed amount of glucose, often 50 grams or 200 grams, is administered, and blood alcohol level is measured at intervals to assess for an increase indicative of fermentation. Non-specific carbohydrate meal test. A less controlled method where a meal rich in carbohydrates is provided, and subsequent blood alcohol level measurements are taken. Stool and blood tests are also used to check for yeast or bacteria in the gastrointestinal tract that can ferment sugars into alcohol. Studies have used variations of these tests, demonstrating an increase in blood alcohol level post-ingestion in patients suspected of having ABS. Gastrointestinal evaluation. Endoscopy, to collect samples from the stomach, small intestine, and cecum for culture to identify fermenting fungi or bacteria. Each step in this diagnostic process plays a crucial role in confirming ABS, helping to differentiate it from other conditions with similar presentations and guiding appropriate treatment. Diagnosing ABS can be tricky, but once diagnosed, how do we treat it? Treatment for ABS focuses on managing symptoms and reducing yeast levels in the gut. This is typically achieved through a combination of dietary changes, medication, and monitoring. Firstly, dietary changes are crucial. A low-carbohydrate diet is often recommended to starve the yeast of its fuel, sugar. This means reducing intake of foods like bread, pasta, and sweets. Next, antifungal medications such as fluconazole, nystatin, micafungin, trichomycin B, and voriconazole may be prescribed to directly combat the yeast. These drugs work by inhibiting the growth of yeast cells, helping to restore a healthy balance in the gut. Antibiotics are used only if the involved agent is bacteria. Probiotics also play a key role in treatment. These supplements introduce beneficial bacteria into the gut, which can outcompete the yeast for resources and help restore normal gut flora. Finally, regular monitoring is essential. This involves checking blood alcohol levels to ensure the condition is under control and the treatment is working effectively. Treatment helps manage ABS. But what does living with this condition mean? Living with ABS can significantly impact a person's quality of life. The syndrome's unfamiliarity can lead to a cascade of misunderstandings, often resulting in social stigmatization. Imagine being accused of secret alcohol consumption, or having your credibility questioned, simply because your body brews its own alcohol. It's not just an inconvenience. It's a serious legal issue that can have heavy consequences. The medico-legal implications of Auto-Brewery Syndrome, ABS, present a significant challenge in forensic medicine, particularly when individuals with ABS face legal consequences related to elevated blood alcohol levels. The defense in such cases often argues that the alcohol was endogenously produced, not ingested. Here are the key points. Challenges in court. Blood alcohol level and breath alcohol measurements from individuals with ABS are sometimes contested in legal settings. The defense may claim that the alcohol detected was produced internally due to ABS, rather than through consumption. Detection and measurement. Studies utilize advanced techniques such as gas chromatography and enzymatic oxidation to measure alcohol levels in blood, urine, plasma, and breath. Research indicates that the human body can naturally produce small quantities of alcohol. However, producing high levels characteristic of legal intoxication, 80 milligrams per deciliter, through endogenous means alone, such as in ABS, is considered rare. Studies on endogenous alcohol production. A study highlighted a relationship between diabetes mellitus and increased endogenous ethanol production. Diabetic patients showed higher blood alcohol levels compared to controls, with values still below typical legal intoxication thresholds. Another study compared urine ethanol levels between diabetic patients and healthy volunteers, finding significantly higher ethanol levels in diabetics over time. The presence of higher than normal alcohol levels in certain medical conditions, like diabetes or ABS, complicates the interpretation of blood alcohol level in legal contexts. Despite documented cases and studies, the ability of ABS to produce alcohol levels high enough for legal intoxication remains controversial and under scrutiny. While there is scientific evidence supporting the phenomenon of endogenous alcohol production, its significance in legal contexts, such as driving under the influence, requires careful consideration and further research due to the rarity and variability of high-level production. The psychological stress attached to these experiences is immense. Dealing with the symptoms of ABS, the social implications, and the constant need to explain oneself can take a heavy toll on mental health. But there's a silver lining. With accurate diagnosis and effective management, these burdens can be significantly reduced. The road to understanding auto-brewery syndrome is paved with awareness and education. The more we know, the better we can diagnose, treat, and empathize with those living with this condition. ABS is a complex condition that can profoundly affect a person's life. Awareness and education are key in improving diagnosis, treatment, and understanding of the syndrome.